This resource has been designed and developed to enhance successful collaboration between clinicians and interpreters. When someone is showing signs that may indicate memory loss or cognitive decline, it may help to determine their ability to understand information and carry out a range of simple tasks. If the person being assessed is from a culturally and linguistically diverse background, it is important to work with qualified interpreters. This will help to ensure successful interactions to promote better understandings between all parties.
This DVD highlights important guidelines and helpful tips for both the clinician and interpreter to successfully work together to complete a cognitive assessment in an older person. In presenting these guidelines, we will incorporate parts of a cognitive assessment using the Roland Universal Dementia Assessment Scale, or RUDAS. The RUDAS was developed as a consistent and reliable tool to measure the abilities of people of culturally and linguistically diverse backgrounds.
Pre- and post-briefing sessions between the interpreter and clinician have been identified as good practice that helps the interpreter-mediated cognitive assessment work well.
Hi, Giovanna. Hi, my name's Dina.
Nice to meet you,
Doctor.
Giovanna.
Today we're meeting with Mrs. Frankie. She's an elderly Italian lady.
Extra time may be needed to complete these briefing sessions, so ensure that interpreters are aware of this when the booking is made.
Judging from her history, I can see that this person is really anxious about being here today, and it's been difficult for her family to get her here. So it would be really important that we make her feel safe and comfortable.
It is also important that the interpreters have been provided with any relevant documents prior to the assessment.
Are you familiar with the RUDAS?
Yes, I'm familiar with this assessment.
Have an open discussion with each other regarding your specific roles and ensure that any questions regarding the assessment and assessment tools are clarified.
So because it is a cognitive assessment that we'll be performing today, can you be sure to interpret everything and tell me if there's questions or concepts that do not translate easily and where you feel that asking the question in a different way may be helpful?
Yes, I'll do that.
Now is also the time to confirm the aims of the meeting before commencing.
Oh, thanks, Giovanna. I think that covers everything. Do you have any questions for me or would like to confirm anything?
No, that's okay. I've done many of these assessments.
Oh, great.
Thank you.
Okay.
Good communication is a key factor to enhancing the interpreter-mediated cognitive assessment. It's important that patients are made to feel as relaxed as possible. This is crucial, as nervousness and anxiety may impact on assessment outcomes. During these assessments, it's important that both interpreters and clinicians ask for help or clarification if needed. Aim to sit in a triangular arrangement to allow for direct eye contact between clinician and patient where appropriate. Please note that direct eye contact may not be appropriate for all patients.
Mrs. Frankie, my name's Dina Lugiudice, and this is Giovanna who will help us to interpret today.
Salve, signora Franchi.
The clinician should use first-person speech with the patient and introduce both herself and the interpreter. Explain how an interpreter works and ensure the patient understands that this assessment is confidential, particularly if the interpreter and patient know each other.
And I want to reassure you that everything is confidential between us.
E voglio rassicurarla sul fatto che tutto sarà confidenziale oggi.
It's important to be aware that in some cultures there is stigma around dementia and depression. This can lead to discomfort or unwillingness to discuss some topics.
So today I'm going to be asking you some questions about your memory.
Oggi le farò alcune domande riguardo la memoria.
And also how you're feeling in yourself.
E anche per vedere come si sente.
Ok, bene, grazie.
Be sensitive when discussing issues that may have cultural significance to your client.
Ok, signora Franchi, nella prossima domanda le chiederò di mostrarmi diverse parti del suo corpo. Ok.
Can you show me your left hand?
Mi può mostrare la sua mano sinistra?
That's great. With your right hand, can you touch your left shoulder?
Con la mano destra può toccarsi la spalla sinistra?
That's great.
Ok.
With your left hand, can you touch your right ear?
Con la mano sinistra può toccarsi l'orecchio destro?
That's perfect, thank you.
Perfetto. Grazie.
The RUDAS has been developed to be culture fair and easily translated into other languages. It has been validated in multicultural samples in Australia.
Mrs. Frankie, I'm going to time you for 1 minute.
Signora Franchi, le darò 1 minuto di tempo.
And in that 1 minute, I would like you to tell me the names of as many different animals as you can think of.
E in quel minuto vorrei che mi dicesse i nomi di tutti gli animali che le vengono in mente.
Va bene.
Ok.
So if you could start now.
Può incominciare adesso?
Cavallo,
Horse,
maiale,
pig,
elefante,
elephant,
gatto,
cat,
cane.
dog.
As you've just seen, the assessment is a straightforward process. However, some communication issues can arise, particularly when working with older people, people with cognitive issues or memory loss, and people from culturally and linguistically diverse backgrounds.
Mrs. Frankie, I'm going to show you an exercise with my hands.
Signora Franchi, adesso le mostrerò un esercizio con le mie mani
And I want you to watch me and copy what I do.
e vorrei che mi guardasse e copiasse quello che faccio.
So can you copy me when I do this?
Mi copi quando faccio così?
Adequate and up-to-date training and resources can provide the best preparation for a successful multicultural cognitive assessment.
Thank you, Mrs. Frankie. We've finished our questions for today.
Grazie signora Franchi, abbiamo finito con le domande per oggi.
Sono molto contenta.
I'm very happy.
For interpreters, this may mean training related to cognitive assessment and the aims and tools of the cognitive assessment. For clinicians, training in cultural awareness and in working with interpreters is strongly recommended. To avoid misunderstandings and to achieve accurate and representative results, it is crucial that clinicians and interpreters work closely together. This teamwork can lead to successful and fulfilling interactions and have the best outcome for all involved.